Aesthetics in Raleigh. And we are excited to be talking about all things breast surgery today. I think most of our questions that came in were about breast implants from you all, but a lot of times that can go into the lift range or some other surgery. So we have a breast expert that you can submit questions as well, but you already submitted some great questions. So Dr. Hunter and I are here to help answer all of those things for you. So hello, sir. Good evening.
Hello, how are you?
I'm great. It's kind of
Excellent.
fun to do this in the evening.
Uh,
Neither of us really drink much, so we have a little beverage in the evening now. This can be our beverage. Do you have one?
There's
Oh,
my
no.
caffeine.
Aren't those bad for you? Could we have a whole topic on like, I don't even know. The Celsius is even make me nervous.
I'm like mainlining caffeine though at this point. I've turned into one of those people that like my blood type is caffeine. So it's probably not the most healthy thing that I do, but I don't know, but it feels good. It's got no sugar in it, so that's fine. I'm good to go for that regard. So yeah, total sugars, zero.
Well, you have
But
three
the
young
caffeine level
kids
is
and
high.
you're a surgeon, so that's okay. I'm addicted to cold brew. That's my thing all day long
Ah.
now. So, well, I'm excited to talk about this. Breast surgery, breast implants was the first surgery I ever did 23 years ago. It was the thing that got me into this industry because you can't work out your breasts. And so I
Right.
felt like I could control a lot of other things on my body except for that. So this I feel very passionately about. And again, not just breast implants. A lot of people come in and they want bigger or they want shape. A lot of women want lift after kids or weight loss or genetics and reductions. So we can cover a version of all three of those. But let's start can you give me an overall, sometimes I don't even know whether people want to call them breast implants or breast augmentation. But let's talk about all things breast implants first. Like, what is your spiel you tell people when they come in for a consultation for that?
So for me, when I start thinking about it, I would say people want a breast augmentation, and I do the breast augmentation using breast implants, right? You can also sometimes do a little bit of an augmentation with, say, using your own fat, right? Sometimes autologous kind of fat grafting. Or some of the newer stuff. Some people may even try to talk about some of this off-the-shelf kind of fat that people can use. That would be a topic for another discussion. But augmentation is going to be making it larger, augmenting, adding to, and then we use the implant. So for me, I prefer to use an implant over, say, autologous or using your own fat because I can control the implant. If I put in 300 cc's of an implant, it's 300 cc's, right? But if I put in your own tissue, even if I put in 300, maybe 100 lives, maybe 50 lives, maybe 200. Who knows? It's kind of a guess, right? And so for me, it is the way for me to make an immediate change, and that's what makes it one of my favorite procedures because, like, on the table, I see this immediate change. It's not this thing where we kind of have to wait a little while. I gotta let it settle, kind of thing, before things kind of go away. And so it's another reason that this is kind of one of the reasons why I kind of got into plastic surgery is that I got into doing breast reconstruction. I got into kind of women's health in that regard. And so doing cosmetic breast surgery is kind of the natural kind of progression for that. And again, and most of the patients that do it, they're healthy, they're young, they're people who are otherwise say fit, right? And or they've been breastfeeding and they've kind of had some changes, things they couldn't control. And then you're able to do this thing for them. Like you talked about working out, right? Like there's no workout to add breast volume. There's nothing, right? And so that's where I get to kind of come in and I get to kind of help kind of finish the journey for you, if you will, kind of along the track for you to kind of be a bit more confident or a bit more help, a bit more happy kind of with your appearance, right, to that regard. So I
Yeah.
love it. I think it's a great procedure.
I think shape is a piece of using an implant too. And we don't do really the fat grafting to the breasts, but I've met some people and I've seen some. And even for me, it wasn't necessarily that I wanted huge boobs. It was that the shape that I was born naturally with, I didn't like either. And I couldn't have achieved the look that I wanted with that. And so I think breast augmentation can get a bad rep sometimes because people just think, oh, women want big boobs and they want attention. And I'm like, oh my gosh, there's so much more that goes into it than that. It's not really about size, honestly, at all. There's no way to create that kind of rounder shape with some fullness at the top, which is what a lot of women want with your own fat.
No, I don't think you can get enough of it just because I don't think you can get enough fat, right? And so I think that in terms of like breast augmentation kind of getting a bad rap, I think a lot of that comes from when people think breast augmentations, even when I have patients who come in and like, I don't want to be overly big, I don't want to be top heavy. Like the initial thought is like this massive implant, right? Like this huge implant from people that, because maybe that was either what was popularized, say Hollywood, social media, not social media, kind of media before social media or whatever. That's kind of what was popular or what was the representation of breast augmentation. But we use small implants. I use them in people that are older. I use them in people that are smaller. I use sometimes an implant that is more round for shape. Sometimes all I'm doing is kind of giving people back the volume that they had before they started breastfeeding. Sometimes people do just want larger breasts, right? But sometimes people, most of the time, they just want better shape. They feel like it's deflated. They feel like they don't like the fact that they're missing some fullness at the top. And the only way to do that is with the implant, as you said. And so I do think it can sometimes get a bit of a bad rep. But I also tell people you'd be surprised when you just go to the pool, right, at
Yeah.
your local community, as to how many people have done it, and you don't know it, right? And that's when you know that it's done really well, right? When it's that did she not? I
Hmm.
can't tell. Like, that's the beauty of it, right? Like, it's not always this 1,000 cc, which I will do that too, right? I will do the whole gamut, right? Whatever it is that's going to make you happy, but that's not everybody. And I would guarantee you more people have had augmentations that you know personally than you know, right? They just don't tell you.
Yep, 1,000%. And you talked about younger fit people. First of all, there's no age limit though, really, for this. You know, we have had some women up into their 70s and 80s, but you're right. I think this was the first thing I thought of. Well, at probably 12 years old, but when I finally did it at 24, 25. And so let's talk about if, again, if someone is skewing on the younger side, but thinks that they might want to have a family one day, like that was something I was so confident though in my decision. I
Yeah.
was like, I know I'm going to have kids and I know I want this. And I was very comfortable with the trade offs of what that could be. But when somebody is deciding to do this before or after kids, and they're kind of in that in between stage, how do you advise them? Should they wait or should they go for it?
No, it was funny. I had this exact same conversation with someone today. I tend to say for the breast procedures, I tend to tell people go ahead, right? I tend to tell people not wait because I think that so a couple things with it. One, if you tend to really be either unhappy with your current appearance or if you tend to really just desire that you had a better shape within a bathing suit or you tend to desire you had a better shape within certain dresses and this is going to kind of help boost your confidence, then I tend to tell people do that thing because when you're planning for children, whether you're married, not married, or you don't know if you're going to have kids, or it may be a thing you do, it may not. You don't know what that time frame is, right? It may be a year, it may be 9 months, right? It may be 5 years, and so I have a hard time telling someone that they have to stay in a body or stay in a position where they aren't the most confident that they can be because they're waiting then to have kids. Now, the tummy tuck, I feel different, right? Because in that regard, it's a different scar, it's an entirely different procedure. But for the breast, I don't think that you have to wait in that regard because we could always do something with it later, if need be. You may not need to have anything done, but if let's imagine you do the breast augmentation now and then you go and you have 5 kids and you feel like at a later time the breasts are a little bit they'll sit a little bit lower than you want. The nipples aren't quite in the position you want. We can always then at that point talk about doing some sort of lift or something like that. But then you have had this time that you've been able to be happier with your body and you've been able to kind of have more confidence and you've been able to have the thing that you wanted without telling you that you had to wait to have those 5 kids. So again, I tend to tell people you don't have to wait for children. I don't think that that's necessarily true. I think when you're ready, right? And then I think if something happens with children, if you're fortunate enough to have them, then if we make some adjustments later, then we can certainly do that.
Hmm. It made me feel better about the breastfeeding thing. It was Dr. Davis, I believe, who said it to me, but I hear the same version of it being told now of just like, hey, you don't know if you can breastfeed anyway.
Hmm.
And so I don't know, somehow that gave me a little more confidence that I'm not going to blame the implants. Maybe if, I couldn't, but I just knew I wanted to do that and everything was fine. I breastfed just fine with both of my kids, but I'm glad I didn't wait just to maybe decide if
That's
that was
right.
something I wanted. I wanted to spend my 20s feeling good about myself.
There you go.
So I do hear, I think that's becoming more and more popular for sure. What about a lift at an implants or just a lift? What if someone
I
gets
was
a
actually
lift before kids? It's a little
I
more
was gonna go.
scarring and
I was
stuff.
gonna go right to there. That's
Yeah.
exactly where you're so good at this. Because I have that conversation with patients. Right, you can talk about lifting implants. You can talk about breast reductions. You can talk about all those things. Right, like anytime I do this surgery, my goal is always to keep the nipple alive. My goal is always, obviously, to maintain as much kind of innervation and things like that. And so I'm not taking away the breast tissue that's behind the nipple. I'm not taking the nipple off, even if it's a lift. That sometimes is a misconception. So I tell people you should be able to breastfeed after I finish this procedure if you could before. Right? Like sometimes, anytime I make an incision around the nipple, you always can get some scarring. There's always a possibility that you could not. But I then like to remind people, right, after having my own children that would then breastfeed, like some people have difficulty breastfeeding anyway, right? There's about 15% of people in the population, I think they say, that can't breastfeed regardless, right, for whatever reason. And so this implant is not necessarily the reason, even if you couldn't breastfeed, that you couldn't, right? It could have been that you just couldn't breastfeed regardless. And so to then tell you that you either have to walk around with what you feel like is excessively large breasts or excessively small breasts or unhappy with the breast shape, just because you may or may not breastfeed at that time, or you may or may not have children. I just feel like that's not a kind thing to do, right, to that degree, and it's not a thing that I would recommend or would want from my family members in that situation, because again, we just don't really know what would happen with it. And if the procedure is done the correct way, you should have enough breast tissue behind. You should still be able to breastfeed. I tell all my breast reductions, I expect you to breastfeed. I tell all my breast lifts, I expect you to breastfeed. All my breast augmentations, I expect you to breastfeed. And so this should not affect that.
There you go. You heard it here. Don't wait. I'm a YOLO girl. I mean, I
Do
don't
it.
think people say that anymore, but I don't
I
know what
still
the
say it, brother.
kids say now. But the same kind of sentiment of just like, do it if you
Right.
want to do it. Don't wait. Okay, I got a couple other good questions. And this one's I'm not exactly sure what she means, but I bet you might know. This person said, "How do I know if my implants are too big for me?" And I'm almost wondering if we're
Good.
talking about like an equation here or something. You and I have talked about BWD before. I don't know. Like it's also, girl, if you want big implants, get big implants, but
There you go. All right. Just as I said, I run the gamut of all those, and I tend to be someone who will put in bigger implants. Right. I think we may end up getting to a point where someone has a question about, like, did somebody put a cap on the implant size, which I
mhm,
don't. Right. Like
mhm,
I think the implant should be as big as you want it to be. Right. Like there are some people, as we talked about shape and size before, there are some people who are like, I don't want anyone to know that I had it, right? I want to be able to go to the pool and no one know. I'm a surfer, right? That's a thing that comes up. I'm a
mhm,
bodybuilder. I am a
mhm,
CrossFitter. I want a little bit of fullness in a dress and a bikini, but I don't want large breasts. Boom, smaller
mhm,
end. Then I have women that come in and they're like, I want everyone to know when I walk into the room that I have large augmented breasts. When
yeah,
I put on a bathing suit, I want it to look like two round basketballs that are sitting on my chest. Can you do this, dog? I pride myself on being able to do both, right? Like, I don't look at someone and say, you need to do this or you have to do this. Tell me what you want, and I will then help you figure out how to get there. And neither of them is right, neither of them is wrong. And so, with that, if it's too big, the only way that you know it's too big is that you feel like it's too big. The way
mhm,
that you know it's too small is that you feel like it's too small. Now, we
mhm,
can always go through some of the proportionality. Does someone look a little bit more top heavy, a little bit less top heavy? Could they use a little bit more volume? Yeah, you can go through those things with an aesthetic eye. But again, this is the thing that I really try to get my patients and then just people in general to know. It's not about what anyone else thinks. It's not about what your surgeon thinks. It's not about your surgeon telling you you have to have 350. What
mhm,
is it that you want? And then your surgeon should help you figure out how to get there, right? Like I think sometimes we get this thing backwards, right, to that
mhm,
regard. Now, is it true that someone could put in either way too wide of an implant, right? That's possible, right? Like they
mhm,
may have put an implant in that was, make up a number, 18 centimeters wide when your chest is 11. And so they might, if there was an option, they probably could have used something that was a little bit more narrow. It also goes the other way. Sometimes people put in something that's too narrow when they should have used wider. That's a little bit more about the dimensions, but as far as volume, I don't believe that there is a too big or too small, right? I'm not from that school of thought by any stretch of the
yeah.
imagination.
And I feel like from my end, so after they saw the surgeon, and really narrowed it down to some implant sizes. I feel like the patient care coordinator, my old role, spent the time talking about almost like how does that fit into your life. And so, especially after I had implants, I was like, ooh, here are some things I've learned. Like, what size dress, do you wear now? And what size do you like? Because I have heard the few people that I have known who have downsized, obviously 90% go up at
Yeah.
some point, which I did too. Maybe 10% go down, but the ones who went down, I don't think thought through like the logistics of like, they were like, I cannot now go to a store and buy a dress, period,
Mhm.
without altering it. And if that is going to bother you, then you should think about that. Or so like, but it is, and I used to tell people kind of like, what's the biggest you would want to be, and this, or the look you want to be here and here, and go somewhere in the middle. You can always play them up a little bit more, but there might be times you want to play it down. And I think those pieces of the conversations are important in a consultation too. And that's why Bustmob rocks so much too. I think people get to really see implants on real bodies and real clothes. And sometimes, like, yeah, sure, she looks great naked, but what does that look like in clothes? Sometimes you can't even tell she has implants then, or sometimes it looks too big. So there's a lot. It's so funny that it's like one of our easiest surgeries or fastest surgeries, but it's the one I used to tell people that easily the consultation took the longest, because it's like, let's talk about placement, profile, projection, size, type of texture. Like, oh my gosh, there's literally so many options, but that's also really cool.
I think there's nuance to it, and I think that that's one of the reasons why I like it. Because again, I like the complicated kind of aspect. It is a thing that you could say, because I remember even from training, where he was like, "It's just easy. You just take the implant, you just put it in." Like, yeah, you do, but like, if you want to get a good result, if you
Yep.
want the patient to be happy, there's much more to it. Because I do know there are a lot of patients who come in and they'll be like, "Well, this physician said they only put in smooth implants, they only put it over the muscle, and they only put in 300 cc." Good for some people, but for a lot of people, that's not the right thing, right? And so if you don't find the right thing, then you don't make the patients happy, which for me is the ultimate goal with that thing. And as you said, like, there's so many things to think about, right? Like, it is activity, right? Like, I have a different conversation when somebody tells me, "Hey, I do CrossFit 7 days a week," versus someone who's like, "All I really want to do is hang out by the pool," right? Like, that's a very different conversation in terms of kind of what their post-operative course is going to be, for sure.
Mm-hmm. So what do you want women to have done research wise before they come in for a consultation versus after? A lot of times I do think people want to come in and feel like they need to have a plan of like, this is the placement, the profile, the everything that I want. Or do you guys discuss that? Would you rather have that conversation in the room?
I think what I would like for them to come in is come in and actually, and I think the pictures are useful, right? And then sometimes I'm an anti-picture person, because I do think that sometimes people can spend so much time on pictures and they can get wrapped up into it, and they're like, "I want to look exactly like her." And it's like, well, she's 5'1", you're 6'6". Like, it's probably just not going to happen. Whatever, make up some random numbers. But like, having some idea of what it is that you want to kind of, so that I can kind of help steer you a little bit. I think the conversation of the over under is a reasonable thing for people to have thought over by the time they come in, right? Sometimes I think it's a reasonable thing just based off of their activity. Yeah. You had to step away. I will finish a little bit. So the over
No, I
under.
got it. I had to yell
Oh,
at my children.
oh, that's okay. I'm not at home. That's the only reason why I haven't yelled. So the over under is, I think, a reasonable thing, because I think that for me, having people think about, like, again, are you someone that works out all the time? Does messing with your muscle bother you or no, right? Kind of thing. That's a reasonable thing to think of. You don't have to have decided it, but think about it. And then I think the lift or no lift is a reasonable question for people to think about. Like, do you like the shape of your breasts, or do you feel like they're too low? Because that way, then you're not surprised when I tell you you need a lift. So those are the three things that I like to have. So that way, it just limits surprises in the
Yep.
consultation. Otherwise, I'm going to go over everything. You don't have to decide silicone versus saline. You don't have to decide profile. I actually would prefer that you don't mention profile, because I think people get hung up on it. But over versus under, lift or no lift, and then think a little bit about what shape you want, right? Because again, do you want this round basketball stuck-on shape? Or do you want this natural, soft teardrop shape that's less full at the top, more full at the bottom? Like, those are things I think that if you can have thought about that, it will help a little bit throughout the consultation. But I'm going to try to pull all those things out of you either way, but I do think that's useful.
Well, good. Well, now I can't decide. You had a couple questions about the like bodybuilding, working out thing. So I definitely want to touch on that on the over versus under. But also, when it comes to kind of the look, do you like it when people bring in goal photos then to kind of, and how many is too many? And
50 is too many, or being
yeah, that's a
extreme.
lot.
I don't know, maybe five, right? Because from between 5 and 10, right? If I'm being realistic, because I don't really care about that person and their stats, to be honest, right? Like if you give me 100 pictures of Kylie Jenner, which we love her, she's popular, like not that useful because they're all kind of the same. What I'm looking for is a pattern. Are all of these girls round? Are all of these girls large? Are all of these girls natural? Like, what do they all have a really tight kind of cleavage? Are they all spread a little bit further apart? Like, I want to see pattern. I want to see that your eye is the same because where the conversations get a little bit more tricky with people is when half of them are round and augmented and half of them are natural. And I'm like, you can recognize that these are all 385cc, but you realize the shape of these is different. So now we got to kind of figure out shape. I'm looking more for shape. And so I say 5 to 10. I do think that people can get overrun on pictures, right? Because I think that you start to kind of get into too much of the nuances. You're like, oh, I like the shape, but she's too big. Oh, I like this. Oh, I want to look just like her. And again, we go back to this thing. I can't make you look just like her because you're not her, right? We talked about the older versus younger patients, right? Like if you're older a little bit and your skin is a little bit stretchier, I probably can't make it look like your skin is 18 again, right? We probably can't do that. That doesn't mean we can't get a great result. It just means that we're probably a little bit limited on kind of where we can get if that's your only goal. That's where 5 to 10 helps because then I can kind of compare that to some other things. So I do think people can get into too many pictures, right? Because I have some of my patients come in and they're like, all I've done is stare at boobs for the past week, right? And then whoever they're with is like, yeah, I wish they'd stop staring at boobs, right? Or I never thought I would say I'm tired of looking at boobs, right? Like I've heard that statement more than once. Because people can get into it, I think, a little bit too much. Maybe it's not the right word, but it can raise a little bit of anxiety. So I think
Yeah.
a few pictures, right, that you find is consistent is useful. And then I say be done with it, right, in that situation. Get a little bit and then be done and then kind of let your consultation kind of do the rest and then guide you. And I will send you back if I think you need more pictures. And if I think I've got enough, then we'll go from there.
Yeah, I think that is actually a great idea. I mean, your eyes can start to cross, and you really
Hmm.
lose perspective when you
That's
look at
correct.
too many, for sure. And yeah, it's almost like have a couple. I like the idea of then hear from you, and then, hey, what would fit my frame? And now I know what. I almost wonder if the word goal photo is like we have made that the wrong word. Should it be like a guide or I don't know, because
Inspiration photo, guide photo. I
yeah.
like those a little bit. Yeah, yeah, yeah.
Yeah. Okay, well, let's talk a little bit about the over versus under thing. I
Okay.
feel like that probably after size or after CCs is the thing that hangs women up the most, and I have been one of them. So, you know, and it's funny. So I had a mammogram today. I had my mammogram today, which is always entertaining. And then I always am like, I want to look at it so I can see the implant. But I right away said, excuse me, your paperwork, you need to put over the over or under. They were calling it like subpectoral, and I'm like, hey, no, it wasn't even that. It was even a crazier description. You had to check. And I'm like, excuse me, ladies with implants do not use this terminology.
Not
You
wearing
need
that.
to update your stuff. But it's always nice to talk to mammogram techs because they're like, first of all, you're like the 19th person today I've had in my office
There
who
you
has
go.
implants. But
Mhm.
they always have good, oh, are they over? Are they under? And they're fun to talk to. But I've had over and under and mammograms with both. But I don't remember where I was tangenting on that. But the over versus under thing comes up a lot when it comes to working out, when it comes to safety for things like mammograms. I used to hear that one a lot. Like, oh, it's harder to see if there was an issue with one versus the other. But what's your current patient ratio of over versus under? And do you see any trends coming with that changing, or is it still just all over the board?
So if you go back and you look at the history of it, people did a bunch of under, then people went to over, and then people went back to under, and now I think with the Motiva implant, people are switching back to over. This is one of those things. It's like size. I don't do only over. I don't do only under. I do the thing that I think is going to give you, I think, the best result. And I haven't switched completely to all the Motiva and over just because I still think it's kind of new, right? For me, I'm still trying to figure out what's going to be the best for the patient. And so for me, I think it's more of a conversation, right? Let's start with the safety profile. I like to make sure that I clarify with people that The detection rates are the same for over versus under, right? The detection rates are the same. And so as long technology has gotten much better with mammograms and whether or not they need to do an ultrasound or an MRI, whatever, like they're going to make sure they can see all the breast tissue. You just have to let them know, which is why you have to check those boxes because they have to do some additional views. So
Mm-hmm.
don't let that be your first guidance, right, from that degree. For me, the big thing I think about over and under is like thinking about activity, right? And so if you are someone who, if you can stand in your mirror and you can flex your pecs and you can make your pecs jump up and down, some women can, some women can't, some men can, some men can't, and you don't like that, then you probably don't want to put an implant underneath it because you're going to still be able to do that with an implant. But if that's not a thing that you can do or not a thing that you can care about, so you can take off the animation aspect. Let's talk about working out with over and under. All right, I just did another video kind of on Instagram that really that kind of talked about like there's this kind of myth that sometimes floats around that says that once you go under, some people say that you can't work out anymore, you shouldn't do chest exercises, or you can't do this or that. It's not true, right? Like your muscle's still intact, the muscle's still functional. You can still do a bench press, you can still do a push up. It's going to feel weird, right? Because that muscle, instead of moving in a straight line, now has to move over top of this implant. But muscles are stretchy and muscles adapt, and so your strength and all that stuff will return to normal. Again, I've had people go back to strong woman competitions, powerlifting, CrossFit, all that. It just feels different, right, to that degree. And so the one group of people that I do think that under the muscle versus over is like a big thing that I do want to kind of lean into a little bit is bodybuilders. And the reason for that is that when bodybuilders get animation and they flex and it moves their implants to the side, I've had more than one patient to say, I don't like this. Not so much that because it moves my implants, but now when I do this, you can't see my lats, right? Or you can't see another muscle that I'm trying to show, right, while I'm doing this. And so for those individuals, moving it in that regard, because they also want to make sure that they can have fully developed pecs. Like those are the reasons why those ladies pick over, and you can see it. So over under is always a trade-off, right? Going over is great, but then you can see the edge of the implant a little bit more. You talk about capsule contracture. The skin is the only thing that holds it up, and so what people will then say is that, okay, well now I'm just going to put in another piece of mesh to help hold it up. Well, you could have just put it under the muscle, let the muscle hold it up, and avoided the other foreign body and avoided having the mesh, right? And if you want a more natural look, then going under the muscle makes more sense because the top of the muscle covers it a little bit better. This is that whole like there is no right way. It's like size. Like there is no anyone. I think anyone who tells you there is a right or wrong way
Yeah.
is skewing you one way or another, right? Like they're trying to, like, there's personal preferences, right? Like you, someone who, if somebody has had over and under, you can listen to their preference, right? They have some kind of say on both sides. But this person A may love over and they are a hard advocate. But this person B is the same thing and they love under and they are a hard advocate. Is one of them right or wrong? No, they're just different, right? And so I, again, pride myself on being able to do both and just figure out what is going to work for this particular patient. What's the look you want? What's your lifestyle? What are you willing to trade up? What are you willing to give up? And what is the thing that you cannot give up, right? Like, what's your hard no? And then we make decisions based off that.
Do you think, is there any main cost difference or feel difference? Or you said there's no real safety issue. I'm just trying to think, is there any strong things that some people come in and are like, I really don't like, I don't know, when it comes to
Yo,
over
I
versus
think so. So we can do this. We can go through all this. So as far as let's talk about the cost difference. Cost is the same because it's the same amount of time in operation.
under?
Field difference. If you are someone who has really thin skin and you're a little bit kind of maybe smaller frame, if you go over, you will feel the implant more. You will have more rippling, right? You will be able to see the implant more. So that's one thing maybe kind of against it, and maybe a reason to go under. If you are someone who has a lot of breast tissue, it doesn't matter if I go over or under, you're not really going to ever feel that implant. So the feel is going to be the same. Again, if you're someone who's thin framed and you're like, I want a really natural look, I want it to look really soft, but you don't have any breast tissue, if I go over, it's going to look augmented. And so I'm going to want to go under because it's going to have a little bit more of a natural slope. If you come in and you're like, I like to work out every day, I am a hairdresser, I need to get back to work. I'm in the military, I need to get back to work in 2 weeks, and I need to be doing push ups in 2 weeks, buddy. What can we do? Over is going to be a better option for you because in that situation, I don't want to damage the muscle. I don't want to touch it. Again, I would have to see kind of what your body habit is, what your breast, how much breast tissue you have, to be able to kind of tell you again the pros and cons. But those are the reasons then maybe for them to say, let's go over, right, to that degree, and let's not avoid let's avoid messing with the muscle.
Hmm.
Capsule contracture was always a big thing, but I do think that with the Motiva implant, even if it's just 1% lower, right? Like maybe the capsule contracture, if you go over, is maybe not as big of an issue. And also, knock on some wood, even with the smooth implants, I've not found it to be as huge of an issue just because I think technology has gotten better. Our implants are better. And so it's not to be kind of, I guess, flippant isn't the right word, but to be like, evasive with it. But I just truly believe in my kind of surgical experience that I don't really think one is better than the other. I do have some, I had some attendings when I trained, they put all of them over. I had some that everyone went under. I just think that when you do that to people, then you haven't given people an option to pick the thing that's best for them. You've done the thing that you feel more comfortable with. You've done the thing
Yeah.
that you always do, but that's not necessarily, sometimes you're putting a round peg in a square hole. And
Hmm.
I try to avoid that. Some people say I make it more complicated than it has to be, but if I can make people happy with that, then I'm happy with it.
Yeah, I'm okay with, says the girl who's
Yeah.
had every placement and every profile and every size. Thank you for the
What's your
choice. If
what's your
someone,
preference? I'm
well,
curious.
again, it's like a recipe each time.
Mhm.
Like it was different, and I had under for 10 years, and then I switched to over because I was having too much, of the, animation. I did not
Mhm.
really, but I was on the thinner side, and I could see it just wasn't this round anymore after
Mhm.
having kids and things like that. So I went over, and immediately I loved the way they looked. They were closer together.
Mhm.
They sat a tiny bit lower, and
Sure.
just I felt like they looked a bit more natural. But then I ran into the capsular contracture issue. So I was like, damn it. But we're finally, we've settled down now, and I think I'm personally happier with the over, but that was just because it looked better on me with whatever my
Mhm.
weird muscles were doing. But I would tell anyone else who walks in the door, oh, if you have no issue and you love your shape, go under, because you have less of a chance of something, like capsular contracture or rippling happening. But so that's what, but I'm so glad there's options for both.
That's
I
right.
think one thing people get hung up on sometimes, and not as much anymore, is also the recovery from each one. Will you tell, like, is it vastly different? Because it used to be like 2 weeks for under and only 1 day for over. And so people were scared
Go.
of the long recovery.
I'm going to tell you 6 weeks no heavy lifting for either of them, right? And what I tend to tell people is that I think you're going to end up in the same place. But I do think what happens is that for under, the track is like this: slow, 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 and then you get back to normal. For over, it's a little more like that, right? Because the muscle hasn't been damaged. So it makes sense that you will recover just a little bit faster. But I still don't want you lifting because that muscle still touches my implant and that capsule is trying to form, and I don't want it to bleed, now, all those things. Because then you get capsule contracture and all those. So I think that thinking that you can do the over and then go and work out the next day just because I didn't damage your muscle is probably going to set you up for problems later, right? Kind of thing.
Mhm.
So both of them 6 weeks no heavy lifting. But I would say if you did have to get back faster and you made me pick one, you probably do feel better with over, right?
Mhm.
Faster. But I think in a year they're the same. Right, that's kind of my thought process with it to that degree, for sure.
Yeah.
And I think the one thing you pointed out before is that with the over, as I go back before, like they will sit lower. I think that's the
Mhm.
thing for people. I think sometimes when people think when they do it, it's going to look extra augmented. But that's where people have started putting in just mesh and things like that to try to hold it. But then I also remind people, and I saw as a question about stress, that mesh doesn't last forever, right? Like most of the meshes that we use in the breast will go away too at some point in time, right? And so then again, it will still sit lower because it will be just your skin. The muscle helps to hold up the implant a little bit. I'm now a firm believer in, for sure.
You had some questions as well about an implant exchange. And so I think we could talk a quick overview of like what that involves. It used to be my favorite thing to tell people that, because sometimes I would spend hours in a consultation with someone agonizing on the size or whatever, and being able to say, you know what, babe, in 6 months, if somehow you absolutely pick the wrong size for yourself, you could stay awake. You can just swap them on out. And like, I think that gave, oh my gosh, did you hear that
Oh,
thunder?
okay. I did. And it hit me here too a little bit.
Oh
So
my God, that was a Wake Forest here. Um, it gave me so much peace of mind. And then I went on to have implant exchange too. But explain to us how an implant exchange is done really quickly. And this person specifically asked, are there risks that increase with each implant exchange? Like, yeah, how many times can you pull that lever?
so
Um,
some people have multiple exchanges, right? Like I think that I don't know if I have a number that I would say you can't do. The risk does go up each time, right? Your risk of like capsule contracture. I think the implant exchange is a simple thing, and I do tell people that. Like when I have people that are agonizing over the size, I do sit down with them, kind of in that kind of last conversation, and say, "Look, I know that this is a huge thing to you, but I want you to kind of recognize that the bigger thing for me is, do we do it or not, and like, is it a lift or not? Because there's some things I can't change. Like once I give you a scar, can't take that away. But
Hmm.
the implant, if we happen to pick one that is either too small or too large, you are not stuck with it forever, right? We can change this thing. And we can get you to where you want to be. And again, it can even be, if you're worried about anesthesia, it can be done in the local, right? I can kind of, with your awake, we can numb it up, we can take it out, we can pop in a new one, and then you're done, right? Right? Takes us an hour or so, 30 minutes an hour. I would tell people that with that, I probably do tend to lean more into the sleep exchanges just because it lets me do more, right? Like let's imagine your implants have kind of fallen to the side. It lets me move them back to the middle. It lets me, if you want to go much larger, it lets me open up the pocket so that I can make sure I can fit it in as opposed to being limited by the capsule. Because once that capsule is formed, it will now only hold so much. But if I open it, I can put in whatever I want to that degree. And so the exchanges, I think, is definitely a thing for people to be aware of because if you get to a point where, again, either feel like they're too large, they're too small, whatever the thing is, it's a thing we can do, right? And again, you do have options of whether or not we're going to do it asleep or whether we're going to do it awake. So definitely an option for sure.
I get a lot of, probably it's my age range, but a lot of the, okay, I've had my implants 18, 19, 20 years. I'm getting worried about them, but I'm pretty still happy with them, but I feel like I should come in. What do you tell people with that?
If you've had your implants for 19 years, I'd probably change it, to be honest. Right? I think you have to do it tomorrow? No. But I do think that you still worry about rupture for implants that are that old. With the newer gummy bear implants, I actually to tell my patients now, I don't tell you to come back in 10 years. When I see my patients and we're done, I tell them I'll check it if you want, but otherwise, if you're happy for the rest of your life, I'll never touch it. We're extrapolating it out to about 30 years, right? But we don't have obviously 30-year data, but that's kind of the thought. So I tell people you have an issue with it in a couple of years, I'll fix it. And if you don't, then I won't touch it. But that's because the newer gel implants are a bit more cohesive and I'm not worried about them running. The old implants, the problem was that the gel would run and it would get pretty nasty and gooey, and we're not as worried about that with the newer implants. So that's why, right? So if you had an implant 20 years old, I tell you change it. But if you get an implant today, does that mean you need to change it again in 20 years? I'd say no, because I think the technology is just different.
Yeah, I love the way it's all going. I don't even want to touch on like safety and breast implant illness and all of those things necessarily, but if you feel the
Whole other
need to, we can. But that could be a whole nother live at some
one in
point.
itself. That's right.
Whew, as I was, again, in the GYN doing my mammogram and everything today, and even they were like, "Tell me your perimenopause symptoms," and it's like this list of this, and they're like, "But do you think it could be something else?" And I'm like, "This is exactly, to me, that is it allergies? Is it my body? Is it a million things?" And it
All
gets
in
very.
one.
I hate fear mongering stuff,
For sure.
and
Same.
so
You can drum up. You can drum up and kind of get into people's anxieties. I think a little bit, which is what I think happens with a lot of this stuff for sure.
yeah. Yeah, I hate that. But you're a great one to talk to about it. So I would tell people direct them to you, DM you, or ask it in the Bustmob community. I know it's a topic, but I do think the ladies in there do a great job of being practical and being
Right.
like, stay out of those groups. Like they're all, it's, if anything that is that hysterical or urgent to me is already a red flag of like, it's,
I just like to
it's
remind people again, without
killing.
going too much into it, it's a loud minority, right? I will tell you, I put in a ton of implants. I don't take out that many, right? I just kind of put it that way.
Yep, I've said the same. I've been here at Amelia for 22 years. I think I may have come across someone who did feel better legitimately after she had her implants out. Um, but I don't think I've ever actually met someone who can say, oh yeah. I mean, or I've met a number of women who have had them out. It didn't solve the problem.
Yeah,
They learned it was something else, and then they've come back and been re-implanted. So everybody has to sleep at night and feel comfortable.
for sure.
But I hate that it's tough to find honest. There's no
Info.
data on it. So
I agree.
um, let's talk about lifts. So this question specifically, was how do I know if a lift is going to be needed? I know those are tough. because some people it's really borderline, and I think those are the I feel so sorry for those women who it's like, well, you could or you could not, it depends on what you want to look like, and that's really, or we could just put a bigger implant in, and it's like, oh my gosh, I don't know. So I know you deal with that question a lot.
That's where the photos actually help,
Mm,
right? Because if you bring me photos that are high, tight, and round and you're borderline, I tell you straight, you need to do the lift. If you bring me photos that are more natural and you're borderline, then you don't really need the lift, right? You can get to that place. So I think that's where it actually comes in if the surgeon then pays attention to what your kind of goals are. If we're kind of just having a discussion, I do think it's a hard one. I like the test of putting the arm up and then seeing what happens with the breast, right? If you like the shape of with the arm up, then you probably need a lift. But it is a hard thing, right? And there are some, on occasion, some patients, and I think I've gotten a little bit better about trying to tease this out, but there are some patients that I just tell them, look, you're in the middle, right? We can put in this implant, we can see what you like, and most people are happy. But if you're not, then we'll come back and do a lift later. That's that kind of almost like the exchange question before, right? Like an exchange statement, like telling them that like you have an out, right, for this thing. Like we
yeah,
haven't burned any bridges, right? Like we can still do this thing. You got to be willing to maybe do two surgeries, but again, these are shorter recoveries, right? Um, 2 days off of work, right, kind of thing, if that, right? And so for those patients, I love it as a staged approach. I just put in an implant first because if we're happy, then we're done. And if we're not, then I come back and do the lift. Whereas opposed to if I do the lift first, then I've added a scar that I cannot take away, right? And
yeah.
that goes back to the size thing, right? Like I like to leave my options open or leave your options open, right? As opposed to doing something that then we can't undo in that situation. And so really when you need a lift, it's like, and I said, we look at your shape. If you're not happy with the shape, right? If you want the breast to be higher, you need a lift. If you look at it, you're like, I just wish I had more fullness here, right? I just wish it was just a little bit larger. I like my nipple. I like how things do. I just wish I had a little bit more volume. Just the augmentation. That's it. And they may sit kind of lower, but that may be something that you like, right, to that degree. So, again, it does go back to what you like, right, which makes it harder. But those are conversations that we do have, and I like to
Yeah.
try to help people work through them.
I love that you give so many options. I guess I can see how someone else might be like, you're making it complicated, but it is complicated. We're complicated humans, and I think women want the choice. So I appreciate that. It made me think you and I were talking about staging surgeries earlier. And I know like that could be a state, a lot of people are doing surgery, combination surgery in stages.
Yeah.
And so what do you recommend? Like that was good for the breasts. Like I love that idea. Do the implants. You might love them. If not, you can come back later and do a lift. But what about other staging of surgery? I know you were talking to patients about that today. When somebody asks, should I do all of this? Maybe they want a tummy tuck at the same time or something. Should I do it all at once or should I do it in stages?
So I think you can do we tend to do like tummy tucks. We tend to do our breasts together. There's some kind of body contouring things we can do together. I think some of the staging things that I kind of work through with patients, the one that kind of still hangs people up a little bit is, let's imagine you come in, you've got double D breasts that are low, that you want to be higher, you want them to be more full, you want them to look like they're stuck on, right? Like you want them
Hmm.
to just be high around. There's not a way to make a double D breast look like that, right? And so then I have to tell those patients that we can get you closer to what you want, but we got to do one or two things. Either you got to adjust your expectations or you got to let me do this in two, right? You got to let me try to do a breast reduction and kind of reshape the breast in the beginning and then go back and do the lift and the implant. Because if I try to do it in the beginning, what you'll still find is that you'll have breasts that are larger, that are more full when you get into a bra, but they still sit low, right? And so that's a thing that I think that over time I have gotten better at and have kind of worked on a bit, trying to recognize that for people. So that is one of the staging things that I think is an awesome tool. And again, it's more about reshaping as the thing that I realized as opposed to just augmenting or just lifting, right? Like really trying to focus on the shape. It's like the shape with the tummy, right? You're trying to really focus on the shape of it. And so for the breast too, I think it's the same way. I think we kind of, at least I try to pay just a little bit more attention to, again, the shape that you want, not just I want to go from an A to a D, right? Or whatever the thing is, but like
Yeah.
what's the actual shape that we want?
Yeah. Well, you mentioned reduction, and I'm glad because I think those can get confused. It can look similar, the outcome to a lift, but what
Ah,
is the
yep.
real difference between a
All
reduction
right.
and a lift?
Perfect. Because this is actually how I got to this thing from them. So, um, I think that sometimes people will tell you that they can do a reduction and a a reduction and an implant at the same time. I think that that can be confusing because the reduction and lift scars are the same. The only thing that's different is how much tissue do I take. If I only take a little bit, it's a lift. If I take a lot, it's a reduction. It's the exact same scar. So you as a patient don't really know, right, to that degree. And so I think that at least in my mind, in my hands, if I am really trying to take out as much tissue as possible, it's no longer a lift, right? It's a reduction. But the thing that gets confusing is that you get a lift with each reduction because sometimes patients will come in and they'll be like, "Oh, I want a reduction and a lift," and it's like it's the same, right? You will get a lift with each reduction. And so with that, if I'm trying to take out as much as I can, then I can't safely put an implant in at the same time, or at least not in my hands. I wouldn't recommend it. So that is why I do it in two stages because I want to debulk the tissue. I want to get the shape the way that I want it. And then I'll go back and I'll add then the volume and reshape with the implant. And so that's then where I get to the staging. Because people will ask, like, well, why can't I just do this all at the same time? And it's just because I can't do it safely. Or I can't do it to the degree that I want to do it. I tell I can take out some tissue, but not to the degree that I want to do it.
What's the recovery different? What do you say in general is a recovery from a lift and then from a reduction?
The same. Six again. We go back to that 6 weeks, no heavy lifting. Yep, they're the same, right? Because I don't do anything with the muscles with either of them. No pulls, anything like that for about 6 weeks. Again, if I do it Friday, you're back to work on Monday. So the recovery for any of those breast things tends to actually be pretty quick, and because we do so much of our rapid recovery exercise where people move their arms, they stretch, we let you do some stuff, people tend to get back really quickly. It's just the heavy lifting, right? I let you run a little bit sooner, I let you do some leg stuff a little bit sooner, just because 6 weeks for me of doing nothing would drive me bat crazy, right? I'd go bananas. So I try to flex on that just a little bit, but really before I have you doing chest activity, it's going to be 6 weeks.
What's your, age range or how young can someone have a breast reduction?
Oh, look at you, Greta. The youngest patient has been 14 years old, right? She's either 14 or 15, but that was in my recon days, right? I would not do that at Amelia. At Amelia, my youngest patient has been 18 just because we don't do pediatric patients. But that was an individual. This is a thing that we go back to before. Like, I love how it all ties in. This is why it's complex, right? Like, should I make her, if she's 14, should I make her go through, just imagine she's gonna have kids at 25. Should I make her go through 10 or 11 years of feeling like she's too top heavy, feeling like she can't blend in with her friends at the mall because they can't shop at the same store, she's uncomfortable at the pool, she has back pain, she has all these things because she might breastfeed at 25? Is that fair, right? Like, I don't think that that's fair. And so in those situations when can't do things that are functional, can't jump rope, can't run, right? Like, then it's time to treat them, right? So that she can get into a functional state. I feel the same way about augmentation, right? Like, even though it's not quite as functional, right? I think that the confidence aspect that comes from it, right? Like, should I make someone not experience the level of confidence and make someone not experience this joy of feeling good about the way that they look in clothing or whatever it is that they want to do, or naked, whatever? Should I make them not do that thing just because they might have kids in a year or 2 years, right? I don't personally think that's fair. So anyway, that's how I get to that. I love when it all kind of comes full circle, right? Whether you designed it that way or not, you did a good job with that.
Yeah, and it's like fashion over function, or what? That's not the right, but like I love that there is psychology and emotion and the soft pieces to all of our jobs, which is why I love this. But then there is like what can be done, and should we do it, and will this meet what her expectations in her head are? It's got to draw them out first. So that's a lot of fun
Yeah.
for me too. I enjoy it. Okay, let me think about one. I got one more. Since weight loss is the topic right now and all the things, and I'm excited to talk about that more.
Yeah.
GLP-1s, all that stuff, especially with Amelia Health. I feel like I hear it every day from all kinds of people. It seems like the most life-changing thing that has happened.
It is everywhere. It might as well be in the water at this point in time, right?
Yeah, I mean, I would be okay with that for sure.
Yeah.
And I've gone through my own. I mean, I've had 2 pregnancies with my implants, and I've gained 20 pounds, and I've lost 20 pounds, and I've run, and then I've lifted weights. It does change how they look. What is kind of the cutoff, of either, hey, I'm losing weight and I'm ready for surgery, and then even kind of after, like, you guys were very honest with me of like, hey, I can see some rippling now. And Dr. Pyle was like, well, you need to gain 10 pounds. And I'm like, no, I'll deal with it. But it was nice. Like he was like, well, it's just skin. So how would I fix
Right,
this for
right.
you? And so I think it's nice to be very realistic with people about weight.
That's right. I think that for me, and this is, I think, a kind of a company-wide kind of policy, about 10 to 15 pounds of your goal weight, right? Because women tend to fluctuate 10-ish pounds within a month anyway, based off of cycle, right? Like, I think that's a reasonable thing. If you happen to lose another 20, 30 pounds after surgery, things are going to look different, right? Just like if someone was heavier and then they lost 60 pounds, massive weight loss, whatever,
Hmm.
then they felt like their breasts were droopy, deflated, and that's why they come to see me, right? It would be the same thing if I do an augmentation and then you lose that same 30 pounds, right? You're going to lose that breast tissue, you're going to lose that volume, and then you may need me to do something different. The way that I usually feel about weight is I always tell people be healthy, right? Be healthy, be happy, right? If I need to retouch something, we just retouch it, right? We can just deal with it. Um, as opposed to telling you that you can't lose any more weight because we've already done this breast augmentation. Obviously everybody has their own kind of autonomy and agency, but in general, like that's the perspective that I try to give people. But as a result of that, I try to get people get to within 10 to 15 pounds of your weight goal before you come and do surgery, right? And if you're within that, then once I do surgery, even if you lose another 5, 10 pounds, you still look good, right? And you might even feel like you look better, right?
Hmm.
But if you do it too early on your surgical weight loss journey and then you can lose a ton of weight,
Yeah.
I just don't want you to feel like you wasted your time, right? Or you wasted
Yeah.
your money because we may have to do something different. And I'll do it, but the results won't hold if you lose a ton of weight. Just like if you gain a ton of weight, right? The results will be different, right? It works the same way.
I appreciate you protecting our pocketbooks too. Like, I love that we tell people, like, no, sometimes. Like, I'm telling you, we want this to last as long as humanly possible for you, and we want
Yeah,
you to love it as long as possible. So, I appreciated it. I think we covered almost all of your questions.
I like it.
Was there anything else I know you and I were like chomping at the bit earlier to say different things about it, but did I cover everything you wanted to cover for the community?
Yeah, I think you got everything out. Like I always love these sessions, right? And so I
Good.
appreciate everybody for joining in and kind of watching this, and I hope everybody got some useful information out of it. It was super fun for
Yeah,
me.
me too. I cannot believe there's 100,000 women in Bustmob. It like it makes me so happy. Given I
Cool.
was like, when I got my implants, we were like doing pen pals basically at that point, like writing letters. Now these women can find
Plus,
all of this information at their fingertips. It makes me so proud. So I'm very excited, especially for people like you donating their time. So we appreciate you, Dr. Hunter. You can find Dr. Hunter in the Ask a Surgeon group. You can follow him on Instagram. It's dr.hunter.amelia. He's located at the Amelia in Raleigh, North Carolina. And I get the pleasure of working pretty closely with him. So I'm so glad.
that pleasure's all mine.
Good. Now finish your caffeine drink and go home to your crazy family.
Yeah, oh,
Um,
absolutely. I need the caffeine before I get home. They're going to be ripping and roaring by the time I get there, so it'll be
yes,
time to go.
they will. Thank you, sir. We'll talk soon.
All right, bye, guys.
Bye.